Sorry, we are now recording. Hope that's okay with everyone. Welcome to this training on culturally and linguistically appropriate services, also known as CLAS. We will explain what that is all about in just a moment. I'm Carla Vermeulen. I'm an associate professor of psychology at SUNY New Paltz in the beautiful Mid-Hudson Valley. I'm also there formerly was the deputy director of the Institute for Disaster Mental Health there. So I've been working with Office of Mental Health and also DISHES, DOH, all the agencies for a very long time, developing a lot of trainings. And so what we're doing today, this CLAS supplement, this really is meant to be an addition or a supplement to the psychological first aid training, which I believe everyone in this audience has already taken. And so we realized that you know, there's not a whole lot on kind of culture and responsiveness and that kind of thing in that PFA training. So we did want to add a little more material on that. So we have just developed this supplement. We're doing 4 deliveries of it virtually to catch people up who had already taken PFA. And then just so you're all aware, moving forward, we will be including this supplement in the live PFA classes. So the goal is to have kind of everyone who does this statewide get that consistent training because we think it is very important. So as Mike said, yes, thanks to Mike Bigley with OMH who is co-hosting and the rest of the team who's here helping out as well. I am not going to be monitoring the chat while I'm presenting because I get highly distracted if I try to do that. But we should certainly have some time at the end for questions, examples. You know, we're a small enough group. We'd love to hear kind of your take on this. If you have examples of this kind of stuff in the field, please, you can add them to the chat at any time. Mike will break in if it's sort of time sensitive. Otherwise, we'll come back to that at the end. And I want to thank Paula Tambasco and her whole team at Beeper for developing this and sponsoring these trainings and making this information available. Okay, so just acknowledgements. We definitely want to kind of give credit. This is largely not original material that we developed. This is kind of a remix of existing CLAS materials that were developed by U.S. Division of Health and Human Services. So this is kind of developed at the federal level. It's been around since the early 2010s, so this is not new. And so there's tons and tons of information on the HHS website. So we've got the link to that there. We'll come back to that at the end and give you information about more trainings if you do want to kind of do a deeper dive into any of this. But do want to give credit that this is really kind of putting together a lot of their materials. So what are we going to do in this hour that we've got? Basically, we want to just kind of talk about what do we mean by culture in a very broad level. Things that we kind of probably all identify as aspects of culture, but then maybe some that we don't necessarily think of, but still are relevant. We will talk about how these CLAS standards came to be and talk about some of the main ones that might be relevant for you in your disaster response work. We'll certainly just talk about why culture matters. It matters to us. It matters when we are the helper, and being sensitive in those various aspects. Talking about just some very specific ways to incorporate CLAS into your preparedness, your planning, and your response, and that includes both planning you might be involved in your own community, and then also if you are deployed to another community as a responder, how do you include all of this? And then again, as I said, we'll come back to just some more resources at the end. Okay, so, excuse me, we wanted to kind of frame this with a little thought experiment that we'll circle back to later. So just imagine that you are in a place that is a different culture than your own, and particularly thinking about language. A lot of what the CLAS focuses on is linguistic sensitivity and availability. So imagine you are in a different place. That could be within the US, but just some place you're not familiar with. That could be a foreign country. And you are there, unfortunately, when some kind of disaster happens. Just think about these questions. What would you do if there was a warning issued, but you didn't receive it or you couldn't understand it because of language barriers? How would you know who to trust? We know for sure in disasters, there's often conflicting information that comes out, including these days misinformation and disinformation. How would you judge someone's trustworthiness and credibility if you weren't kind of familiar with who are authorities and people with knowledge in that area? If you needed to be rescued and you couldn't understand the instructions you were being given, and that includes verbal and nonverbal communications. What would that be like? I think it would be terrifying personally. And then thinking a little longer term, if you were stressed, traumatized, needed help, needed mental health support, and again, you're still in a place where maybe there are those cultural differences in the expression of mental health issues and the linguistic differences. How would you try and communicate across those barriers? So think about that from the perspective of being the disaster survivor, and then we'll come back to that and flip that to think about being a responder towards the end. All right, so our first main section is simply, what do we mean by culture? And it is tremendously broad and tremendously complicated, but also rich and powerful as well. So this definition is from the CLAS guidelines. So there's a lot in here. I'll read this and we'll look at a couple of the points of this because I think this demonstrates just how complicated this stuff is. So integrated pattern. So it's not just one thing, it's an interaction across different parts of people's lives, including thoughts, communications, actions, customs, beliefs, values, and institutions. So all of the societal thing, individual up to societal level, associated wholly or partially. And as we'll see, sometimes these aspects are more relevant, sometimes they are less at a particular time, with racial, ethnic, groups, religious, spiritual, biological, geographical, sociological characteristics. Culture is dynamic in nature. It changes over time, that can be, year to year for people at some levels, but minute to minute as well. And certainly individuals may identify with multiple cultures over the course of their lifetime. So a lot in there, just kind of keep that in mind as we break all of this down. So this idea of intersectionality, this is kind of, having a moment, I would say, but intersectionality is just the point that we are not one thing. I mean, I am female, I am of European heritage, I am married, I am a bunch of things which define me, but all of those things are put together in different ways that really define me. I would never identify myself as only female or something like that. So this idea of overlapping and interacting, and I know I keep saying this, but some parts of this are going to be more relevant at certain points, some will be less at other times, and some of that is just, who are we around? Are we in a place where we are not of the majority in any of these aspects? That's likely to make us more aware of this. So that relevance of those different intersecting identities can be positive, can be negative, and that's, I think, really important to keep in mind in times of disaster or high stress when you might be trying to help someone. So these are some elements of culture. And I think, again, some of these are sort of obvious, but some of these are maybe a little subtler or less that we're aware of. Things like occupation. Many of you probably work with first responder populations, potentially, depending on your role. Well, even, first responders, that's a culture. Within that, you have law enforcement, firefighters, corrections officers, healthcare providers. Even if people are kind of broadly in that responder occupation, there are subcultures within all of those. And it's very important to be familiar with those cultures, because you're not going to have trust from people if they don't think you understand their particular roles and their particular challenges. Some of the others, certainly country of origin. If we're talking about supporting people who have immigrated to the US, and I'm going to kind of assume that you are responding within New York State, but we have enormous immigrant populations here. Depending on where people are from, they may be kind of more adapted to US culture, New York culture, and even like New York culture. What do we mean by that? Like Long Island culture is different than New York City culture, is different than Hudson Valley, Western, it's not as simple as just we're all in New York State, so we all share values and identities and things like that. But anyway, if someone has immigrated, what country did they come from? And then also, what is that degree of acculturation that individual has achieved? Have they really kind of adapted? Have they learned the language, the attire, food habits, all of those kinds of things? And I think it's always worth noting, if you are working with a family where maybe the parents have immigrated, but the kids were either born here or were brought here very young, those kids might be fully acculturated to US norms and expectations, while the parents might not be. That itself can sort of cause friction, kind of intrafamilially as well. So very important aspects of culture for people. Health practices, do people follow mainstream Western medical practices, or do they use alternative practices that some people might see as very, very worthy and valuable, and others might see as, superstition or not effective? That's going to influence people's certainly experience of seeking care for sure. I won't get into all of these, but just encouraging you to sort of think more broadly about all the different aspects of culture that might be influencing these individuals who you're trying to support. So back to this point about relevance of each of these aspects varying by setting. Sometimes that can be tremendously powerful and supportive. I mean, I think of people who have a deeply held faith-based practice, whether that's a formal religion or more of a kind of spirituality approach. If they are in church, synagogue, mosque, wherever, meeting with their coven, I don't know. But when they're with kind of fellow believers, sometimes that can be tremendously powerful and supportive, that kind of idea of being sort of in congregation with people or in fellowship with people. But if they are in a setting where that is not the standard practice and not the norm, the majority, people can feel very othered, can feel very kind of singled out, like they are different, like people think maybe something is wrong with their belief system. And sometimes, we're just not even aware of these things. I mean, if you are at home with where everyone kind of believes the same thing, that might just not be something you were thinking about at that point at all. I always think of the Zen cone of, if you ask a fish what it's like to live in water, the fish will respond, "What is water?" Sometimes we're just in our natural environment and there's nothing that's making us kind of question that. And in those cases, doesn't mean culture's not significant. It's just we're not conscious of it in those times. Okay, so why does this matter when we are thinking about disaster response in particular? Well, first of all, we certainly want to recognize that there are historic inequalities, inequities that very much, I'm sure everyone is aware of this, increase certain groups' vulnerability, susceptibility to having worse experiences in times of disaster. And so some of that is, we used to sort of say disasters don't discriminate. I think that's nonsense. They absolutely discriminate, right? I mean, where people live, the quality of their housing, their resources, their access to healthcare, they're all of these kinds of cultural and institutional norms that very much tend to not benefit recent immigrants, communities of color, and certainly just anyone living in poverty. We know certainly people at the lower end of the socioeconomic status are very vulnerable in times of disasters, for sure, both in terms of having worse exposure and a harder recovery process. So I think we just want to remain aware of some of these factors, and I think, acknowledge them more than ever right now in our current climate. But, some of these ongoing structural racism, for sure. Access to education, access to homeownership. In the US, there have been very biased policies around zoning and access to mortgages and all those things that mean there are tremendous differences in rates of homeownership between different races. Many groups have good reason not to trust the healthcare system or mental health providers. Some groups, whether that's religions, certain ethnic or racial groups, there's a long history of basically misuse and even outright abuse at the hands of healthcare providers. And so there's often stigma. There's a reluctance to trust these systems, to not acknowledge any kind of mental health needs, because that can be seen as a vulnerability someone else is going to exploit rather than support. So I won't get into all of these, but these are all just kind of factors we want to be aware of in terms of increasing that level of vulnerability or just, higher demands in times of disaster. We also have to acknowledge in this field that sometimes culture is used to target particular groups in hate crimes, in acts of terrorism. So, I mean, these are just a few examples that were kind of top of mind when we were putting this together, but there are plenty more in this. So certainly the Pulse nightclub shooting, that was a nightclub that primarily served LGBTQ plus individuals, as well as a Latinx largely population. And of course, that doesn't mean that everyone who was there the night of the shooting was gay or queer, but many of them were. And a lot of the people who were there who either were killed or injured or who were survivors, especially for the survivors, many of them were not out to family members or to their employers. And so essentially they got outed just by their presence being there. And so that added another layer of trauma potentially and kind of ripple effects of that event. Then certainly we've had at least 2 mass shootings targeting African Americans. There was the Charleston church shooting, and then more recently, the Top supermarket shooting in Buffalo in 2022. In both of those cases, it was young white men who identified as white supremacists who went specifically to areas almost entirely inhabited by African Americans and targeted those Black people to murder, basically. I'm going to talk more about the Buffalo shooting in a minute and some of the kind of lessons that were learned out of that. And then the shooting in the Tree of Life Synagogue in Pittsburgh several years back, that was an anti-Semitic motivated shootings. There have also, of course, been anti-Muslim shootings. And so, no particular religious group has been free from that kind of targeting. But there you have situations where people are kind of in, especially the ones in the nightclub and in the churches and the synagogue, people are what should feel like a safe setting where they are with people who share their values, and instead those were selectively targeted. So deep trauma associated with that. The flip side of this, of course, is we really want to recognize that culture can also be a source of strength and resilience and bonding. And so, because culture is so significant, it often does get kind of heightened or activated in times of high distress. And so people can sort of turn to each other. This is when you get Buffalo strong or Boston strong or Lewiston strong. That sort of seems to be the slogan that automatically comes up after these events. And it's genuine. I mean, it's not like putting a positive spin on things. But I think the kind of potential downside to that potential upside is that it often does kind of lead to a sort of closing of the ranks. That kind of in-group, out-group bias is maybe a strong word for this, but that sense that if you are not of this community, of this culture, however we're defining that, we don't want to talk to you. You can't understand. You are an outsider coming in. And sometimes that is the case. I mean, we know the way disaster response works in New York State is very often, because, yes, you're going to draw on local mental health resources for sure, but those often are not sufficient, or those people might be great as being counselors or social workers or chaplains, but they're not specifically trained in disaster mental health. And we know that that's very important to have that specific training, which is why we're glad all of you are here. And this really did happen in Buffalo after the Top shooting. There were certainly plenty of mental health experts of color in the community, but there again, OMH and Red Cross kind of put out a call for responders to come in and help support those local efforts because the need was just so incredibly large. But basically, very few of those people who were deployed to the area were people of color. And so, they were well-intentioned. They were probably really great at being disaster mental health responders, but they were not who community members wanted to talk to at that particular moment. And so it did cause, a little bit of friction, is my understanding. But it also led to recognition that we need to train up more people in these communities. And so that led to development of a new training program on stress resilience and psychological first aid that we've been doing in Buffalo over the last year and a half, and that is now hopefully going to get rolled out to other communities in the state. So lessons were learned, but at the cost of recognizing there was this gap in training and preparedness. Okay, so this brings us all back to our culturally and linguistically appropriate services. So basically, we just want to emphasize it's important for people to be aware of this and to incorporate this. And it's really more of like a philosophy, I think, than specific steps you're going to take, although we will get into some of those as well. But it's not just a matter of this being sort of ethically, morally, professionally the right thing to do. It's also just going to make you more efficient. If you don't have this understanding, you're going to be seen as that out group, don't understand us, can't help us. And so you're not going to be as effective, which is why we really want to emphasize this need at this moment. Okay, so what do we mean by this? So HHS definition, so way to improve the quality of services provided to all individuals, which will ultimately help reduce health disparities. It's about respect and responsiveness. I like that language. So respect the whole individual, so all of those different parts of their culture and identity, and respond to their health needs and health preferences. So I will note, it is primarily focused on physical health care, but all of these same principles absolutely apply to mental health services as well. And I think that point about not only health needs, but health preferences, I think that's a really important part of this. Sometimes we can think, well, we're the experts on disaster mental health, therefore we know what this community or this individual needs, but that is not necessarily the case. They know what they need, and so we need to kind of take that like bottom-up approach rather than dictating what we think should be provided. So just very briefly on some of the history of this. So as I said, developed in the 2010s. So there are these 15 national standards, which are kind of like guiding principles. And they are broken down into kind of these three areas. So governance, leadership, and workforce, communication and language assistance. That's what we're really focusing on in this training. And then engagement, continuous improvement, and accountability. So depending on your role, you might benefit from learning a lot more about these other areas. But basically all of them are, you can read the definition here, tended to advance equity, improve quality, help eliminate healthcare disparities by establishing a blueprint for organizations. So this is kind of the national kind of overarching principle statement that kind of covers everything. So provide effective, obviously we want to be effective, equitable, and remember equitable doesn't mean exactly the same for everyone. It means balancing out past inequities so that everyone gets the same advantages based on what their actual needs and resources are. Understandable, certainly that's a key part with all of the language, and respectful, quality care and services, responsive to diverse health beliefs and practices, preferred languages, health literacy, and other communication needs. Okay, enough definitions. So what is so this is another kind of goal within these standards. And this is something where if you have a role in your community, your county, whatever level you work at, in making disaster plans, which I'm sure many of you do, this is something we really encourage you to focus on, this idea of developing community partnerships in advance. So this is, just that practice of working with whatever groups are there, recognizing, do you have large groups of certain immigrant populations or non-English speakers? Okay, how can you best prepare to meet their needs linguistically and culturally? And often that is going to be done through making those relationships. And so much of it is building trust, and who that's going to be with is going to vary. Maybe that is with a spiritual leader, and that could be someone formal or less formal. Maybe that is with people running social service agencies that support some of these groups in a particular area. Maybe it is working directly with the stakeholders, meaning the individual citizens who are ultimately going to be impacted when disaster strikes. And trusted messengers, who is going to basically give you the thumbs up that you are trusted. Back to that point I made in our beginning thought experiment. Well, if these groups in your community don't know who to trust, but they know, okay, if our pastor says this person is okay, or if they know the barber says, or hairdresser says this person, you can trust them, that is going to go much, much farther probably. It's almost like those people are like ambassadors in terms of building your status and trust in that community. Engaging community members in decision making and action. That's the point I made just a minute ago about don't assume you know what's right for people, but work with the community, and some of this in terms of that planning and preparedness, that could mean doing focus groups. When we were developing the new curriculum for Buffalo on the expanded psychological first aid, that started after we were informed that our existing PFA was not what the community needed, politely, and accurately, I will say. We did a whole bunch of focus groups and pilot trainings, and we really revised that in collaboration with various constituents from within the community, people who work with youth, people from the faith-based community, arts organizations. It was hard to do that. I will say it was a real investment in time, but I think it really paid off. So I'm a real believer in this practice. And it, there's the old saying about the time to be exchanging business cards isn't at the scene of the disaster. That is basically what is being encouraged here. Reach out and make those connections in advance, so you are then activating them when they're needed rather than forming them in a chaotic situation. Okay, so that was kind of if you have a role in planning. Now we're going to kind of switch back to probably your main role your role in terms of this training in terms of disaster response. So talk the next couple of slides about these premises of cultural competence and cultural humility. We always used to talk in the field about pursue cultural competence, become culturally competent. I think there's much more recognition now that you can never be fully competent in the sense of knowing and understanding and communicating everything about another culture, even about our own cultures, I would argue. But to me, sort of cultural competence is more kind of the skills and the knowledge you're trying to acquire, while cultural humility is more kind of your underlying attitude or your acknowledgement of the impossibility of achieving total cultural competence. So, but competency is basically this process, and it is a process that is never ending, of trying to build awareness, knowledge, and skills to work and communicate effectively. Versus humility, we'll get into some specifics about how to do that on the next slide. Humility is more the reflective process, so again, a process of understanding one's own biases and privileges. So the humility is really kind of focusing more on yourself and then recognizing those power imbalances between you, your culture, your professional role, and the people you're supporting. And then just this idea of openness, that we can and would benefit tremendously from learning about other cultures and interacting with those cultures, and really trying to strive for that understanding. So how do we actually do this? So some different aspects of cultural competence. So first of all, just learning about your culture, for those of us, and I am from majority cultures in many of those aspects of my life, but that doesn't mean I shouldn't be questioning and recognizing my culture, and in particular trying to understand other people's, what do they identify with, what are their values, all of those things which we've been talking about throughout. Combating bias and stereotypes. So with this, I think this is not just recognizing bias and stereotypes, but taking a more active approach to combat them. So, sometimes this is defined as anti-racism, not just enough to not be racist, but you have to call it out when you see it and try and challenge those institutional and structural inequalities. And it doesn't have to be just about race. It can be about all the things we've been talking about. Certainly respecting others' beliefs and values and communication preferences. I'll talk in a little bit about verbal and nonverbal communication, doing that effectively across cultures. Expanding services to meet each survivors' needs. So not just thinking, that one size fits all, but recognizing, okay, maybe we need to add another layer, add, something else to what we're doing. And then just gaining new cultural experiences, which, if you are open to that, can be tremendously enriching and rewarding. And I'd say that's professional or personally as well as professionally. Then aspects of cultural humility. So practicing self-reflection, so really consciously paying attention, recognizing what is the water that I live in, what are my beliefs, and this idea of implicit biases. We all, almost all, maybe some people have, risen above bias and stereotype entirely, but I think we all have some judgments, some, expectations of other cultures that maybe we're not proud of and that we're trying to get beyond. Those are more sort of explicit biases when we recognize, oh, this is something that's not accurate and I need to get over whatever I was socialized to believe about this group. So that's important and significant. I think potentially more significant is recognizing this idea of implicit bias. So these are things that we're often just not even aware of. These are those unconscious stereotypes or misperceptions that we might have. And what's tricky about them is we might not be aware of them, but there's plenty of evidence that they still do shape our behaviors, our language, our interactions with people. So just, trying to really become conscious of what we're not currently conscious of. Recognizing what you don't know, learning as much as you can. I think the third point about being open to people's identities and empathizing with their life experiences, I talk about this a lot with students, like counseling students, of, empathy versus sympathy. We can't, sympathy is basically when you're feeling with someone, which is fine when it's a loved one, but when you're interacting with people on the professional level, that's going to be overwhelming and lead to burnout and compassion fatigue and all those occupational hazards. To me, empathy is trying to imagine what it's like for someone, what it's like to live their life, to have had their experiences. So you can never fully understand what someone else's experiences are like, but you can try, and you can sort of be open and again, doing this in a kind of non-judgmental way. And maybe that person has had to make choices that you don't fully support or agree with, but they did them because they had to do them at that point. And so, just being aware of that and viewing them, and to me, this is always kind of the golden rule, do unto others. I always think about, you probably heard me say this in PFA trainings if you've taken them with me, but I always say, today I'm the helper and they are the person in need of help, but that was just the luck of the draw. Tomorrow those roles could be reversed. They could be the one in a position to be supporting me going through a really awful time. If that were the case, how would I want this person to be thinking about me, judging my decisions, judging my behaviors and values? I wouldn't want them to be judging me. So I need to try not to do that myself. Acknowledging they're their own best authority. I think we've talked about that plenty, but that's, individual level as well as kind of community level, and just learning and growing from other people whose worldviews differ from yours. So those are all not easy things to do, but they are, I think, good goals to strive for in this kind of pursuit of both cultural competency and cultural humility. Okay, so bringing this back to how do you actually do some of these things? In particular, if you are going to respond to a disaster, and now mostly what I'm talking about through the next few slides is if you do get deployed somewhere else, so now you are, representing or in your Office of Mental Health or affiliated role in another area. So first of all, you want to get informed as much as possible about what is going on locally. What is the history? What are the demographics? What are the issues going on there? Because if you are not familiar with that, you're going to have that, you're an outsider, you don't understand us perspective. The good news with this is that if you are being deployed elsewhere, you are not directly responsible for acquiring this information. You will be provided usually a sort of fact sheet produced by your shift supervisor, who would typically be someone local, someone from that area, that county. So that is going to include the basic demographic information, what populations are there, what have historical interactions between some of those groups been, so you know of any kind of history of conflict or resentment or perceptions of inequities or things like that. What are attitudes towards law enforcement and political authorities? Some places they're basically trusted and believed, others, as we've been talking about, very much not so, and sometimes for historically valid reasons. Point I just made about resources, and just kind of what else is going on in terms of what should you, as an outsider, and you are an outsider, what should you be prepared to know? Again, most of this you'll be provided, but these are just things, you want to be asking about if you're not. And let me make it clear, if there's information that you need, chain of command is you ask your shift supervisor, and then they go up the ICS ladder as necessary to get that information. So you shouldn't be kind of jumping that chain of command. Stick with your shift supervisor. They are your point person for any needs that you have in order to be functioning most effectively in that community. Okay, so other resources, just kind of what is going on, what languages are being spoken. Very importantly, what resources do you have? If you have a large Spanish-speaking population or Chinese-speaking population or whatever, do you also have a supply of interpreters who are trained in order to do this, do that effectively? You certainly want to avoid ever using children as interpreters with parents, even if the children speak both languages. That is a power imbalance. That is exposing kids to things they shouldn't. So that is to be avoided. But there are a lot of technological solutions now. Google Translate on your phone is kind of frighteningly good at this point. So not the easiest way to interact with someone, but there are kind of backups. So just what are other linguistic issues, phrases you might want to be aware of that are used in that area, those kinds of things. And then just all of these other things that we've been talking about. So general cultural values, what are attitudes around help seeking? As I said before, many groups still really stigmatize acknowledging mental health issues, especially to someone outside of what is perceived as of their culture. So are you looking at challenges there that are going to make it harder just to connect with people? What are perceptions of the disaster? Is this being seen as, punishment from God or karma? Is this seen as something that should have been prevented? Was it just bad luck? Should authorities have done more to warn people and protect people? Those are really going to shape how people are going to interact with what are perceived as representatives of the government, of authorities. If there was a warning and people didn't evacuate, why not? It's easy to judge people for not, we told you to get out. Well, did people have transportation? Do people have funding? Did people receive the warning? All of those issues, because they're probably beating themselves up for not having evacuated. So if you can understand what at that broader level might have prevented them from doing that, maybe you can help them kind of process that and, correct any distorted perceptions or things. Certainly fears around documentation status, very relevant and salient and real now. So, is that going to be a big issue? And if so, what is guidance in terms of trying to work around those fears and limitations? And then just again, how are you going to be seen as a representative of the government? And what can you do to build, or to act on those hopefully pre-existing community partnerships to help build that trust? Okay, and then a few points on verbal and nonverbal communication. So first of all, very much part of the CLAS standards is to ask someone what language do they prefer to interact with you in. And even for people who maybe speak English quite well as a second language, first of all, if they are highly stressed, often people lose some of their second language skills, or they might just be more comfortable talking about some things in their native language. So if that is the case, how are you going to adapt to what those preferences are? Set that tone of openness, being genuine, being not, having all of those markers of non-judgmentalness. We'll come to nonverbal communications in a moment. Seek permission to engage. Some people are not going to want to talk to you, especially if they know you are a mental health professional, and that is fine. That is certainly their right within their autonomy. Speak clearly and at a moderate pace, particularly if you are dealing with people who are non-native English speakers, but even for anyone who's feeling overwhelmed. We know when people are highly stressed, cognitive capacity is not what it typically would be. So you always want to use simple language, unambiguous language that's not going to be subject to misinterpretation or confusion. And I always think if you're talking to someone who is not a native English speaker, it's good to slow it down a little bit and sort of enunciate, have kind of clearer pauses between words so they can decode the words more easily, which I'm typically a very fast talker, so I always have to kind of remind myself to do that. No, we are not saying speak loudly here. That is not helpful in terms of people understanding, but more, slow it down and speak as clearly as you can and maybe simplify your language a little bit. Listen without judgment or interruption. That there are real cultural differences in this. Some cultures, a lot of Latinx cultures, it's very common for people to talk over each other and or talking at the same time or jumping in. Other cultures, particularly many Asian cultures, that is very rude. That is not acceptable. Leaving room for pauses and for silence is much more the norm. So I think for this, take your cue from how the individual you're working with is speaking and kind of model, you're not imitating or mocking certainly their speech patterns, but kind of take your cues from them, as I just said. Invite questions and check understanding. This is so important. This is where you want to use those reflective statements we talk about in psychological first aid. So it sounds like, it seems like, am I hearing you right? You want to have those checks. So say, reflect back. It sounds like what you're most concerned about is XYZ. Am I getting that right? Because especially if there's a perceived power imbalance, or that kind of sense of this person is not getting me, people often will not challenge what you're saying unless you openly invite them to do that. So you want to make it clear you want to hear them. You want to be corrected if you're not actually getting what they are saying. And then just always remember, you are there to walk through this with the person, not to tell them what to do, not to convince them you know what's right. Again, just that respect for individual autonomy. And sometimes that's hard. Sometimes it can seem like there's a pretty clear course of action that you think would benefit this person the most. But if they are not in agreement with that, you have to kind of back off and let them take the lead in that. Then some nonverbal communication styles. So thinking again, and obviously some of this overlaps with what I was just saying about verbal, but tone of voice, volume, are people speaking very loudly? For some people that's perceived as threatening or bossy or inappropriate. So bring your tone down. As I said, slow it down. Eye contact can be a tricky one. Most sort of Western cultures tend to think eye contact is a sign you are paying attention. It's a sign of equality. It's a sign of respect. But for some cultures, and certainly just for some individuals, it feels threatening or rude or off-putting. So here again, sort of take your cue from the person. If you're sort of naturally trying to make eye contact and they avert their gaze every time you do that, someone in a training taught me this. It can be really useful to kind of soften your gaze and kind of direct your view at like their ear. So then you're sort of still in your peripheral vision. You can still see kind of facial expressions and things, but you're not looking directly at them, if that is seeming to be troubling for them. Similar also things like, physical distance. How close are you standing to someone when you're talking to them? Uses of pauses and silence. I just said this, I know, but giving a pause, and we talk about that in PFA too. Like sometimes people, even apart from culture, people just need a moment to process what they are going through. So, but silence can be so hard to tolerate sometimes. So just, training yourself basically to just give it a beat. And that's hard also, especially, if you've got a lot of stuff you need to do and not enough time to do it. But for some individuals, some cultures, that's just a sign of respect, and that's going to make you more effective if you can tolerate that. Facial expressiveness, same points I keep making, emotional expressiveness. I am aware that I have a very expressive face. I've been told I have the opposite of a poker face, but for some people that's just too much. So I have to kind of tone it down a little bit and, contain myself a little. Amount of self-disclosure. Western cultures tend to have that more kind of individualistic, we talk about our own experiences, but that's not appropriate in some settings. Or that can also just be perceived as like you're trying to turn the attention to yourself rather than on them as the person in need of help. Level of formality. And I think a big part of that is kind of, formality of sort of body language and I don't know, facial expression, all of those things. But also, I've been learning in my work in Buffalo, I've been learning about how important how you address someone is. I tend to go in as call me Carla. To me, that's sort of a sign of equality and that I'm not trying to put myself above anyone. And I learned in working with some of the people in Buffalo, they found that off-putting, that it was like almost offensive to them. So a lot of the people I work with there, we're friends now. They call me Dr. Carla, and I call them Ms. Brenda, Ms. Vanessa. So it's kind of it's a level of formality that doesn't come naturally to me, but I've had to adapt because that is what is comfortable for them and appropriate. So that was another good lesson for me. And then just directness. Some cultures, you cut to the chase, you say what you need to say. For others, it's referred to as more kind of context driven. You sort of talk around something and people come to their conclusions about it. And being very direct can, again, be seen as rude or inappropriate. All right, so those are just some of the kind of both practical skills and knowing if you're going to be deployed, here are things you should be thinking about. A few of these communication styles we hope you'll consider. Going back to the beginning, to our original thought experiment, I don't know if people have different or more thoughts about this now, about what it would be like to go through a disaster in an area where you're not familiar with the culture, with the power structure, with the language, all of those things. So, again, I've thought about this a lot, and I think it would be terrifying for sure. So now let's do that reversing the roles thing again. So now let's go back to you as you are now the helper somewhere in New York or somewhere else where you are part of essentially the dominant culture. How would you shape that? How would you try to make sure that warnings are getting to the people that need them in the language and complexity level that is going to be understandable to people so that they can hopefully choose to take that protective action and reduce the effect of the disaster? How would you earn their trust? How are you going to work through those community partners and get that credibility rather than just trying to invent that or create that on the spot? What is your plan going to be if there is someone you don't share a language with? Learn to use Google Translate on your phone, learn whatever other services are going to be available in a place so that you have that action or that plan to activate rather than figuring it out while you're there. And then just thinking at the more broad level, how would you try to address culturally different from your understanding, stress reactions, trauma reactions, and that very well might be, connecting them with their spiritual care provider or their community leader, someone who really does understand, recognizing sometimes that's going to be more effective coming from someone other than you, but you certainly can help make those connections if that is what is appropriate. Okay, so we are wrapping up, just a couple more slides on resources. If anyone does have examples, questions, thoughts, comments, anything like that, this is a great time to put them in the chat while I just finish up pointing you towards some resources if you do want to learn more about these standards. So this is the same link that we gave at the beginning, but this is kind of the central clearinghouse at HHS for all of the content here. So they have links to a whole lot of resources. There are some video role play examples, just a ton of tip sheets, getting into more detail on some of these points, planning documents, all of that kind of stuff. So that's a really good resource for you. Oh, in fact, Skip or Mike, or if someone could even just like drop that in the chat. We meant to set that up in advance and we forgot to, but so people have that, that would be great. So it's just thinkculturalhealth.hhs.gov. And then if you want to do a really, really deep dive on this, and we recommend this particularly if you are in that more kind of planning role, organizational role, this is a 9-hour long online training course in everything you could possibly want to know about these standards. So it is free. You can get continuing education credits in some fields, up to 9 hours of that. You can certainly dip in and out of it, stop as you need to. But this has kind of all the stuff. So this is highly recommended if you want that really intense experience of stuff. And then last point is if you have any questions for OMH about, and this is not just about these standards, but anything related to disaster preparedness and response, this is the main email address. So it's DMHOMH for Disaster Mental Health, Office of Mental Health at omh.ny.gov. This kind of everyone on the team monitors this, and then they'll sort of direct queries or suggestions coming into this to the most relevant person to follow up on them. So that is another good resource to be aware of. And that is it. So let me stop my sharing and take a look if we have anything in the chat. And I will say we do have one more delivery of this training. That is going to be on Friday, April 18th from 10 to 11 a.m. So if you thought this was useful and you want to recommend it to any colleagues, coworkers, whatever, please spread the word about that. And you can, I guess, reach out to that same email address and they'll figure out how to get you registered for that. And I think that they will be doing another email promotion, most likely, about that for people to sign up. So that is all I've got. Oh, thanks, Skip, for putting that in. Any questions? Okay. Mike, Skip, anything you want to add? Mike, I think you are still muted.
I don't have anything to add. I think it's a very complete presentation. And thank you, Carla. For everyone else, if you have other questions, and you have ways to contact us, emails or your own team leaders, all kinds of things. So just the Think Cultural Health is here in the chat if you want to copy it. The DMHOMH email is there. So, and I think we're pretty much complete, and we've got a couple of thank yous over there, Carla. So you can see those if you want. But